Good day, everyone. Community mental health represents a fundamental shift in how we approach psychological well-being. Rather than waiting for crises to emerge, we focus on prevention, early intervention, and building resilient support systems within the communities where people live and work. Mental health challenges affect 1 in 4 people globally, yet traditional institutional models often create barriers to access. Community-based approaches recognize that effective mental health support must be culturally relevant, accessible, and integrated into existing social structures. Exploration begins with understanding how social determinants shape mental health outcomes. We'll examine evidence-based strategies for reducing stigma and discrimination, which remain significant barriers to help-seeking behavior. The module emphasizes practical application through case studies from diverse global contexts, demonstrating how successful programs adapt universal principles to local needs whilst maintaining sustainability and cultural appropriateness. These learning objectives guide our comprehensive examination of community mental health practice. You'll develop skills in identifying at-risk populations and understanding how social inequalities create mental health disparities. We'll explore evidence-based stigma reduction techniques and learn to design culturally appropriate advocacy campaigns. The focus on sustainability ensures you can create programs that endure beyond initial funding cycles whilst maintaining effectiveness and community ownership. Community mental health emerged from recognizing that institutional care often disconnected people from their natural support systems. The approach prioritizes accessibility, ensuring services reach people in familiar environments rather than requiring them to navigate complex healthcare systems. Integration with primary care creates seamless pathways to support, whilst utilizing existing community resources maximizes efficiency and cultural relevance. Natural support networks, family, friends, community leaders become partners in recovery rather than external observers. The deinstitutionalization movement fundamentally transformed mental health care delivery. Large psychiatric hospitals, whilst providing safety, often created dependency and social isolation. The shift towards community integration recognized that recovery occurs best within supportive social environments. However, the transition wasn't without challenges. Many communities lacked adequate resources to support discharged patients. The evolution towards recovery models and peer support represents our growing understanding that lived experience provides invaluable insights for effective intervention design. Community-based services operate across a comprehensive spectrum of care. Prevention focuses on identifying risk factors before problems develop, addressing social isolation, economic stress, or trauma exposure. Treatment services integrate therapeutic interventions with primary health care, making support more accessible and less stigmatizing. Rehabilitation emphasizes skill development and social reintegration, whilst advocacy ensures systemic barriers are addressed. Each component reinforces the others, creating a robust support ecosystem that responds to diverse community needs. Early intervention represents one of the most compelling arguments for community mental health investment. Research consistently demonstrates that addressing mental health challenges promptly reduces both individual suffering and societal costs. The 70% reduction in symptom severity reflects how early support prevents escalation into more severe conditions requiring intensive treatment. Cost savings of 50% result from avoiding emergency interventions and hospitalizations. Most importantly, early intervention preserves social connections, educational opportunities, and employment prospects that are crucial for long-term well-being. Vulnerability in mental health isn't randomly distributed. It concentrates in specific populations facing particular stressors. Children and adolescents experience heightened vulnerability due to developmental processes and limited coping resources. The statistic that half of mental health conditions begin by age 14 underscores the critical importance of youth-focused interventions. Elderly populations face unique challenges, including social isolation, physical health decline, and grief from multiple losses. Understanding these patterns helps us target resources effectively and develop age-appropriate interventions. LGBTQ+ communities face minority stress, chronic stress from discrimination, rejection, and concealment of identity. The 2 to 3 times higher rates of mental health conditions reflect the psychological toll of navigating hostile environments. Indigenous populations carry the burden of historical trauma, intergenerational effects of colonization, forced assimilation, and cultural disruption. These communities often lack access to culturally appropriate services that understand their unique worldviews and healing traditions. Effective interventions must address both individual symptoms and systemic inequalities. Barriers to mental health care operate at multiple interconnected levels. Individual barriers include self-stigma and poor symptom recognition. Many people don't realize their experiences warrant professional support. Social and cultural barriers reflect community attitudes and family dynamics that may discourage help seeking. Systemic barriers include inadequate provider networks and fragmented services that require navigation skills many lack. Geographic barriers particularly affect rural populations who may travel hours for appointments. Understanding these layers helps design comprehensive solutions addressing multiple barriers simultaneously. The relationship between poverty, environment, and mental health creates a vicious cycle that's difficult to break. Poor living conditions, overcrowding, noise, unsafe neighborhoods create chronic stress that affects brain development and emotional regulation. These environmental stressors contribute to anxiety, depression, and cognitive difficulties, particularly in children. Mental health challenges then limit economic opportunities, perpetuating poverty. Breaking this cycle requires interventions that address both environmental conditions and psychological well-being simultaneously, recognizing their interconnected nature. Stigma represents one of the most significant barriers to mental health recovery and community well-being. Public stigma manifests through stereotypes portraying people with mental health conditions as dangerous, unpredictable, or incompetent. These attitudes lead to discrimination in employment, housing, and social relationships. Self-stigma occurs when individuals internalize these negative beliefs, leading to shame, reduced self-esteem, and reluctance to seek help. Structural stigma appears in policies and institutional practices that systematically disadvantage people with mental health conditions. The impact of stigma extends far beyond individual discomfort. It creates systemic barriers that affect entire communities. The average 8 to 10-year delay in help seeking means conditions worsen unnecessarily, requiring more intensive and costly interventions. Treatment non-adherence often reflects fear of being identified as having mental health problems rather than lack of insight. At the community level, stigma reduces social cohesion and prevents development of supportive environments. Addressing stigma isn't just about changing attitudes, it's about creating conditions where recovery can flourish. Effective stigma reduction requires strategic, evidence-based approaches. Education alone isn't sufficient. Simply providing facts about mental health doesn't necessarily change attitudes. Contact interventions, where people interact meaningfully with individuals who have lived experience, prove most effective at reducing prejudice. Protest strategies can raise awareness, but may inadvertently reinforce negative stereotypes if not carefully designed. The most successful programs combine multiple approaches, ensuring messages are culturally appropriate and delivered by credible messengers within specific communities. Storytelling represents a powerful tool for stigma reduction because it creates emotional connections that transcend intellectual understanding. Personal narratives humanize mental health experiences, challenging stereotypes through authentic human encounters. Stories provide hope by demonstrating recovery is possible whilst acknowledging genuine struggles. However, storytelling must be approached ethically, ensuring storytellers are supported. Stories are authentic rather than sensationalized, and diverse experiences are represented. The most effective programs train storytellers in safe sharing practices and provide ongoing support. Cultural competence in mental health messaging requires deep understanding of how different communities conceptualize well-being and distress. Direct translations of Western psychological concepts often fail to resonate or may even offend. Language matters enormously. Terms like mental illness may carry different connotations across cultures. Traditional healing practices shouldn't be dismissed, but rather understood and potentially integrated with evidence-based approaches. Successful programs engage community leaders, respect existing belief systems, and adapt interventions to align with cultural values whilst maintaining therapeutic effectiveness. The Friendship Bench program exemplifies successful cultural adaptation in mental health intervention. Rather than imposing Western therapeutic models, it builds upon existing Zimbabwean concepts of mental well-being. The term kuvurapfungwa resonates with local understanding whilst maintaining therapeutic effectiveness. Training grandmothers as counselors leverages existing respect for elders and creates sustainable, culturally appropriate support systems. The program's success demonstrates that effective mental health interventions must be rooted in local wisdom, whilst incorporating evidence-based practices. Mental health advocacy encompasses systematic efforts to create positive change in policies, systems, and social attitudes affecting people with mental health conditions. Advocacy operates at multiple levels, from individual support to systemic transformation. It involves speaking with and for affected communities, ensuring their voices are heard in decision-making processes. Effective advocacy combines lived experience with evidence-based arguments, creating compelling cases for change. The goal isn't just improving services, but transforming social conditions that contribute to mental health challenges. Mental health advocacy operates across different scales and approaches. Grassroots advocacy emerges from communities directly affected by mental health challenges, often led by people with lived experience. These movements create authentic, powerful voices for change, whilst building local capacity and solidarity. Policy advocacy focuses on systemic change through legislative and regulatory channels, requiring different skills, including policy analysis and stakeholder engagement. Professional advocacy leverages clinical expertise and research evidence to influence practice standards and resource allocation decisions. Successful advocacy requires strategic planning and systematic approach. Issue identification must be grounded in community needs, assessment and input from those directly affected. Advocacy without authentic community voice often fails. Research and analysis provide the evidence base necessary for credible arguments, whilst identifying key decision makers and potential allies. Clear, measurable goals ensure efforts remain focused and progress can be evaluated. Effective advocacy campaigns balance urgency with patience, recognizing that systemic change often requires sustained effort over time. Sustainable wellness initiatives improve well-being and reduce environmental impact. Key areas include green workspaces with plants and natural light, active transportation like biking and walking, sustainable nutrition with local food, and resource efficiency through recycling and energy-saving measures. These initiatives enhance morale and reduce stress, as seen in a 22% stress reduction at Marks & Spencer. Emphasizing sustainability in wellness programs benefits both employees and the environment. Sustainable community mental health initiatives must balance environmental, social, and economic considerations. Environmental sustainability involves minimizing ecological impact, whilst recognizing the connection between environmental health and mental well-being. Social sustainability ensures programs remain culturally appropriate and community-owned over time. Economic sustainability requires realistic funding models that don't depend solely on external grants. The most successful initiatives integrate these dimensions, creating programs that benefit both human and environmental health, whilst remaining financially viable long-term. Environmental factors significantly influence mental health outcomes, creating opportunities for innovative intervention approaches. Green spaces and nature-based interventions provide therapeutic benefits, whilst promoting environmental stewardship. Community gardens address food security whilst creating social connections and purposeful activity. Forest therapy and conservation volunteering combine mental health benefits with environmental protection. These approaches recognize the interconnection between human and environmental well-being, creating programs that benefit both simultaneously whilst often requiring minimal financial resources. Resource-limited settings require innovative approaches that maximize impact whilst minimizing costs. Task-sharing models train non-specialist community members to deliver basic mental health support under professional supervision, dramatically expanding service capacity. Peer support networks harness the therapeutic power of shared experience whilst reducing professional staffing requirements. Technology-enabled interventions can reach remote populations cost-effectively. These approaches don't compromise quality. They recognize that effective mental health support can be delivered through various models when properly designed and supervised. Monitoring and evaluation ensure community mental health initiatives remain effective and responsive to changing needs. Meaningful indicators must reflect what matters to communities, not just what's easy to measure. Participatory evaluation approaches engage community members as partners in assessment, building local capacity whilst ensuring cultural appropriateness. Regular feedback loops allow programs to adapt and improve continuously. Effective evaluation balances accountability requirements with learning opportunities, using data to strengthen rather than simply judge program performance. The Friendship Bench program demonstrates how innovative approaches can address multiple sustainability challenges simultaneously. Cultural relevance ensures community acceptance and ownership. Task sharing with grandmothers creates a sustainable workforce whilst respecting traditional authority structures. Low resource requirements make the program financially viable in resource-constrained settings. Income generation through craft activities addresses economic sustainability whilst providing therapeutic benefits. The program's expansion across multiple countries validates its adaptability and effectiveness. Atmiata illustrates how effective programs can emerge from existing community structures rather than imposing external models. Village champions leverage established leadership networks and social trust, reducing implementation barriers. Simple visual materials overcome literacy challenges, whilst maintaining message clarity. Integration with existing health systems ensures sustainability and reduces duplication. The program's success demonstrates that mental health interventions can be both culturally grounded and evidence-based, achieving effectiveness through adaptation rather than standardization. The World Health Organization Mental Health Gap Action Program provides a framework for scaling mental health interventions globally. Evidence-based intervention packages ensure quality, whilst enabling non-specialists to deliver effective care. Integrated implementation within existing health systems maximizes efficiency and sustainability. Supportive supervision maintains quality standards whilst building local capacity. The program's success across diverse contexts demonstrates that systematic approaches can achieve both standardization and cultural adaptation, providing a model for global mental health scale-up. Schools provide ideal environments for mental health promotion due to their universal reach and existing infrastructure. Social-emotional learning programs build resilience and coping skills before problems develop. Teacher training creates a workforce capable of identifying early warning signs and providing initial support. Anti-bullying initiatives address significant risk factors for mental health problems. School-based programs also reduce stigma by normalizing mental health conversations and demonstrating that seeking help is a sign of strength rather than weakness. Workplace mental health programs benefit both employees and employers through improved productivity, reduced absenteeism, and lower healthcare costs. Clear policies provide frameworks for supporting employees whilst protecting their rights. Employee assistance programs offer confidential support for personal and work-related challenges. Mental health first aid training creates peer support networks within organizations. Stress management initiatives address workplace factors that contribute to mental health problems. Successful programs require leadership commitment and employee involvement in design and implementation. Faith communities often serve as first points of contact for people experiencing mental health challenges, making them crucial partners in community mental health initiatives. Religious leaders possess established trust relationships and regular access to community members. Existing infrastructure and gatherings provide platforms for mental health education and support. Spiritual frameworks can complement evidence-based treatments when integrated respectfully. Successful partnerships require mutual understanding, with mental health professionals respecting religious beliefs, whilst faith leaders understand the importance of professional treatment for serious conditions. Post-disaster mental health requires comprehensive approaches that address both immediate trauma and long-term recovery needs. Preparation involves building community resilience through social connections and coping skills before disasters occur. Immediate response focuses on psychological first aid and restoring basic safety and security. Long-term recovery addresses ongoing trauma, grief, and community rebuilding needs. Effective programs recognize that disasters affect entire communities, not just individuals, requiring interventions that strengthen social cohesion and collective resilience. Practical application consolidates theoretical learning through hands-on experience. Community assessment requires systematic investigation of local needs, resources, and cultural factors that influence mental health. Program design challenges you to translate evidence-based principles into culturally appropriate interventions. Implementation planning addresses practical considerations, including staffing, funding, and community engagement. Evaluation design ensures programs remain accountable and responsive to community needs. Collaborative work mirrors real-world practice where effective mental health initiatives emerge from multidisciplinary partnerships. Stigma reduction campaigns require careful planning to avoid unintended consequences. Target audience analysis ensures messages resonate with specific communities rather than using generic approaches. Message development must balance accuracy with emotional appeal, avoiding both oversimplification and overwhelming complexity. Channel selection considers how different audiences access information and which messengers they trust. Evaluation measures both attitude change and behavioral outcomes, recognizing that changing minds doesn't automatically change actions. Successful campaigns often require sustained effort over time to achieve lasting impact. These key takeaways synthesize the essential principles for effective community mental health practice. Community context shapes every aspect of program design and implementation. What works in one setting may require significant adaptation elsewhere. Integration ensures mental health support becomes part of broader community life, rather than a separate, stigmatized service. Sustainability requires balancing immediate needs with long-term viability, considering environmental, social, and economic factors. Advocacy drives systemic change that addresses root causes rather than just symptoms. These discussion questions encourage critical thinking about practical application of community mental health principles. Cultural considerations challenge you to move beyond theoretical understanding towards culturally responsive practice. Sustainability challenges require creative problem-solving and resource optimization. Stigma reduction approaches must be tailored to specific contexts and populations. Advocacy strategies need to balance idealism with pragmatism. These discussions help bridge the gap between academic learning and real-world practice, preparing you for the complexities of community mental health work. These resources provide pathways for continued learning and professional development in community mental health. The WHOMHGAP program offers practical implementation guidance for low-resource settings. Academic texts provide theoretical foundations and research evidence. Online platforms connect you with global networks of practitioners and researchers. Professional organizations offer training opportunities and advocacy platforms. Engaging with these resources helps you stay current with evolving best practices and connect with the broader community mental health movement. We conclude our exploration of community mental health and advocacy with a shared commitment to action. The principles and strategies we've examined provide a foundation for creating meaningful change in communities worldwide. Remember that effective community mental health work requires patience, cultural humility, and collaborative partnerships. Each of you has the potential to contribute to building more mentally healthy, resilient communities. I encourage you to continue learning, connecting with others in the field, and applying these concepts in your future practice.